Hello everyone. In this video we are going to discuss few multiple choice questions on gait disorders. We will look at myopathy gate or waddling gait, frontal or apraxic gate, Parkinsonian or extrapyramidal gate, vestibular gate and cerebellar ataxia. I suggest you to search these gates in YouTube and see few videos. There are many videos demonstrating these gates. However, in this video I will describe how these gates would be. First, let's look at a multiple choice question and go through the discussion. In this multiple choice question, it says 20-year-old present with waddling gait. Which of the following are possible causes? There are 5 answers: acute vestibular neuritis, Duchenne muscular dystrophy, cerebellar stroke, osteomalacia, and spinal muscular atrophy. So you need to know which of these conditions cause waddling gait and which of these conditions do not cause waddling gait. So let's go through the discussion and find out the answers. So the first gait we are going to discuss about is myopathy gait or waddling gait. By the name you may suggest that waddling gait occurs due to myopathic conditions. Let's look at the features of myopathic gait. Here, the reason for waddling gait is limb girdle weakness. So, the pelvic girdle start waddling because of this weakness. Therefore, waddling gait and abnormal pelvic tilt with each step will be there. As you can see in this picture, the person looks like walking like a duck. So that's the waddling gait. Mainly waddling gait occurs due to proximal muscle weakness. So let's look at what are the causes causing waddling gait. I have listed down 5 causes. So you need to remember these causes. The first cause is myopathies. So any type of myopathy can cause waddling gait. And next, muscular dystrophies also can cause waddling gait. So you know the muscular dystrophies: Duchenne muscular dystrophy, Becker's muscular dystrophy. So those conditions can cause waddling gait. Then sarcopenia and osteopenia. Sarcopenia means less muscle mass. Osteopenia means less bone density. Osteopenia may progress to osteoporosis as well. Then osteoporosis also can cause waddling gait. Then myasthenia gravis can cause waddling gait. And then spinal muscular atrophy is also a cause for waddling gait. Like that, we went through 5 causes of waddling gait: myopathies, muscular dystrophies, sarcopenia and osteopenia, myasthenia gravis and spinal muscular atrophy. So remember these 5 causes for waddling gait. Then let's look at frontal or apraxic gait. What are the features of apraxic gait? Here, the patient has difficulty in initiating or maintaining walking. And also, there are short shuffling steps. And disequilibrium can be there. So by the name you can understand that frontal lobe involvement may be there and bit of cognitive impairment, and the gait would be like as described here. The causes for Apraxic Gate: one is normal pressure hydrocephalus, vascular dementia, and neurodegenerative dementias like Alzheimer's dementia or frontotemporal dementia. So these causes can cause Apraxic Gate. So now you know the features of Apraxic Gate and the causes for Apraxic Gate. Then let's look at Parkinsonian Gate. In Parkinsonism, the extrapyramidal tracts are involved. So the clinical features of Parkinsonian Gate: there is narrow based gait and reduced stride length. The patient takes short steps that looks like hesitating. So please search Parkinsonian Gate or extrapyramidal gait and watch few videos, then you will understand these features better. Then the feet barely clears the floor and the patient will have a stoop posture. You can see in this picture the patient is slightly bent forward and having a stoop posture. And also the patient will swing the arm very minimally during walking. Those are the features of Parkinsonian Gate. Then what are the causes for Parkinsonian Gate? Obviously, Parkinson's disease is a cause. Then Lewy body dementia can cause Parkinsonian Gate. And vascular dementia also can cause Parkinsonian Gate. Those are the causes for the Parkinsonian or extrapyramidal gait. Then let's look at vestibular gate. Vestibular gate occurs due to involvement of the vestibular tracts. So it affects the balance of the patient. The features are: there's deviation on walking to the side of the affected ear, and the legs are slightly spread. The stride length is reduced, and this gait is often associated with nystagmus. So like that, the vestibular gait can occur. The causes for vestibular gait is benign paroxysmal positional vertigo, we call it BPPV, vestibular neuritis, venous disease, brainstem or cerebellar stroke. So these causes can cause vestibular gait. Then the fifth type of gait we are going to discuss today is cerebellar ataxia. By the term you can understand that it occurs due to some kind of cerebellar pathology. What are the features of cerebellar ataxia? There is stumbling, lurching, staggering, reeling, drunken-like, and slowness. So you can imagine a drunken person, how that heavily drunken person walk in the road. So that would be like the cerebellar gait. Also there will be reduced step length, wide base, and cerebellar signs also will be there. What are the causes for cerebellar ataxia? Cerebellar stroke, cerebellar tumor, alcohol ingestion, drug toxicity, and there are hereditary and neurodegenerative ataxias. Those are the causes for cerebellar ataxia. Now we have discussed about 5 types of gait in this video. Now let's again look at the previous question and try to answer. Now in this question, you have to select the causes for waddling gait. If you can remember, I mentioned 5 causes for waddling gait: myopathies, muscular dystrophies, sarcopenia or osteopenia, myasthenia gravis, and spinal muscular atrophy. Here, the first condition mentioned is acute vestibular neuritis. You know that vestibular neuritis causes vestibular gait, not waddling gait. Therefore, A is false. Answer B is Duchenne muscular dystrophy. It is true. Answer C is cerebellar stroke. You know that cerebellar stroke causes cerebellar gait, and also it can cause vestibular gait as well, and it is false. Answer D is osteomalacia. Osteomalacia is caused due to defective mineralization of the bone. You know that osteopenia can cause waddling gait. Like that, osteomalacia is also a possible cause for waddling gait. Therefore, D is true. Answer E is spinal muscular atrophy. You know that it is a cause for waddling gait. Now you know the answers for this multiple choice question. Then let's look at another question. This question is not directly regarding the gait disorders, but let's look at this question. A 75-year-old man presented with recurrent falls. What is the most suggestive diagnostic feature of Parkinson's disease? This question is about Parkinson's disease. However, in the answers it is mentioned something about waddling gait as well in the answer E. The correct answer for this question is in Parkinson's disease there are 4 cardinal symptoms, and among them 3 cardinal symptoms are used to diagnose Parkinson's disease. Here, cogwheel rigidity is a cardinal symptom. So the correct answer would be cogwheel rigidity. However, I chose this question since waddling gait is mentioned here. You know that waddling gait is not a feature of Parkinson's disease. In Parkinson's disease, the gait is Parkinsonian gait or extrapyramidal gait. Let's look at another multiple choice question. Here it mentions a 72-year-old male was brought to the hospital by his wife. Wife complains that her husband has forgetfulness and poor concentration during last few months. She also complains of urinary incontinence and abnormal walk for the last few months. On examination, he is having an unstable gait. Fundal examination is normal. What is the most possible diagnosis? So in this question, this is a single best answer type question. You have to select the best answer here. Here a history is given, and this is also not a question directly regarding the gait disorders. However, this patient has some gait abnormality as well. This patient is having an unstable gait. This patient has urinary incontinence and poor concentration and forgetfulness. So the correct answer for this patient would be normal pressure hydrocephalus, because the forgetfulness and poor concentration with urinary incontinence and unstable gait occurs in normal pressure hydrocephalus. In normal pressure hydrocephalus, I mentioned that the gait is Apraxic Gate or frontal gate. However, if we go through these answers, when you learn about normal pressure hydrocephalus, you can easily answer these type of questions. I just selected to show you the importance of the gait disorders and Parkinsonian gait, motor neuron disease, spinal muscular atrophy. I mentioned that Rodling gait can be there, and there are many types of motor neuron diseases. In Alzheimer's disease also it causes Apraxic gait. So let's look at another question. This is also not regarding the gait disorders but regarding Parkinsonism. Features of idiopathic Parkinsonism, it has mentioned several answers, but I will go through the answer D. It mentions broad-based gait. You know that broad-based gait is not a feature of Parkinsonian gait. It is a feature of Cerebellar Ataxia. So here broad-based gait is false. Let's look at another question. In a patient with weakness in lower limb, myopathy is suggested by. There are few answers, so myopathy is a separate topic. So let's look at the answer C only here. So Rodling gait, you know that it is a feature of myopathy. So myopathy causes Rodling gait, so answer C is true here. Like that, the knowledge on gait disorders is important for you in many occasions while answering for your MCQ papers. So you go through this video again and refresh your knowledge on gait disorders. We will discuss about another important topic in the next video as well.